Hi, I'm your local San Jose chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. Today I'm going to talk to you about standing desks. A lot of people use standing desks at their workspace. They're good and they're bad. Some people just stand all day when they get their sit-stand desk, and that's not really the point of it. The sit-stand desk is supposed to be used for sitting and standing for both. We can't just stand still for 8 hours a day, 5 days a week. But what we can do when we're standing in our desk is we do fall out of good posture, just like we fall out of good posture when we're sitting. So I wanted to bring up a different sort of approach to standing where we can address the different postures that aren't really the best for standing. And the first one that I'm going to talk about, which is the most common, is basically just bending one knee, kicking your hip out to the side. Doing this is just giving your foot a break, which is fine. We do want to give our foot a break when we're standing every once in a while and switching to the other side. And we do this whether we're standing at our desk, whether we're waiting in line somewhere, or just standing anywhere for too long. Even for a short time, we end up just doing this subconsciously. And what I want to bring up is that there's a different way to give your foot a break when you're standing. You don't have to do this. What you should have, if you have a standing desk, is something to put your foot on, a footrest. It doesn't have to be an actual footrest that you buy online or wherever you get footrests from, ergonomic stores. There's some ergonomic showrooms, but most of it is, you can just get these online very easily. When you use a footrest, you do want to use it when you stand. Again, it's not just for sitting. And the way that you will use it when you sit, or when you're standing rather, is I'm going to use my foam roller as an example because I don't really have a desk. I don't really sit or stand too much. I'm usually just working on patients and running around. So I do have a foam roller though, and you can once again substitute your footrest for anything that you have, whether it be a box, book, ream of paper, whatever it may be, before you get an actual footrest, or if you get something that's pretty sturdy, you can be your permanent solution. So basically what we're going to do is we're just going to put our foot on it like this, and that is basically all it is. Very easy. You want to switch and put your other foot on too when you get that sensation that you want to shift your hip out. Another position you can use when you stand at your desk is you can also use a wide base stance, and when you cycle between the positions of being neutral and then one foot on a footrest, switch and put your other foot on a footrest, and then you can also use this wide base stance. When you're cycling between those positions, it gives you enough variety for standing for throughout the day, but they're all neutral positions that you can use, and that's what we want to use. We don't want to be doing anything that could be causing more issues. When we do this, once again, we're kicking our pelvis out of a neutral position. It can cause that hip or low back pain. So to take full advantage of your standing desk, make sure to cycle between those neutral positions. And I hope that helps. I'm your local San Jose chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. Thank you for watching.